Hi, I'm Dr. Scholz. Let's talk about prostate cancer. We're going to cover perhaps one of the biggest technological breakthroughs in the prostate cancer realm over the last 5-10 years, MRI imaging of the prostate. This tool has a lot of potential to be used in many different roles, and we're going to cover them today in this video. Let's talk about screening for prostate cancer. MRI can replace the standard 12-core random biopsy. It's more accurate, it doesn't entail a risk of infection, it's not nearly as unpleasant, and of course it can be used for guidance if you need to do a biopsy as well. You should be aware of something called the PIRAD system, where an expert assigns a number to a spot that's detected from 1 to 5. The 5s being most consequential. So a well-read MRI done at a center of excellence will indicate whether or not prostate cancer is likely to be present, and it'll also indicate where in the prostate that suspicious area is located. Historically, PSA has been blamed for all the problems of overdiagnosing prostate cancer, when in reality it was the random biopsy. Now that we have MRI scanning, we're able to look through the prostate without having to overdiagnose low-grade forms that no one really wants to know about anyway. So the second important role for MRI is to use the scan to guide a needle biopsy to the correct location in the prostate. One big advantage of using MRI for screening is that a certain percentage of individuals won't need any biopsy at all. If the MRI is clear, there's no need to push ahead with any biopsy. But MRIs will detect spots in a certain percentage of patients. And when it becomes time to think about doing a biopsy of that abnormal area, consider that there are 3 different approaches called in-bore biopsy, cognitive fusion biopsy, and ultrasound fusion biopsy. A cognitive biopsy means that the doctor looks at the MRI scans and sort of figures out in his own mind where to stick the needle. An ultrasound fusion biopsy uses fancy software with an ultrasound machine to take the MRI images and guide the needle to the correct area. An in-bore MRI biopsy means that you go back to the MRI center, and while you're in the MRI, the needle is directed to the appropriate area with a robotic device. All 3 methods have different uses and different times. All of them are dependent on skillful implementation, experienced doctors that have done this a lot and know what they're doing. The third important use for multiparametric MRI is to stage prostate cancer in men that already know that they have the disease. How large the tumor is, what part of the prostate it's located in, does it come through the edge of the gland or through the capsule? And perhaps most importantly, does it invade into the seminal vesicles, which are immediately adjacent to the gland? This information will guide treatment because more extensive disease requires more aggressive therapy. The MRI gives the most accurate indication of the size of the tumor, its extent, and whether it's still contained inside the prostate or not. The fourth way that MRI is utilized is in helping determine treatment for men that may be having a relapse. Men that have had previous surgery or radiation and develop a rising PSA have to be evaluated as to where the cancer is located. Sometimes it's where the prostate used to be, or in the case of radiation, back inside the prostate. Multiparametric MRI can help determine the location of the cancer in and around where the prostate used to be. If the MRI detects a recurrence of the disease in the prostate after radiation, for example, a cryosurgeon or a HIFU expert can direct treatment to that area and possibly cure the relapsed cancer. In men that have had previous surgery, if a spot of cancer is seen where the prostate used to be, called the prostate fossa, radiation to that area may be curative. Most people are aware now that many types of prostate cancer are so low grade they can be safely monitored. The method most relied upon for monitoring these men is to do repeated 12-core random biopsies every 2 to 3 years. This policy has been in place for over 10 years and it's widely accepted. Progressive thinking doctors, now realizing that the MRIs are more accurate than the biopsies and they're certainly far less dangerous, can substitute for the random biopsies. When MRIs are used in this role, sequential images can be compared chronologically over time to determine if there are any abnormal spots and if those spots are either getting larger or developing aggressive characteristics. If a change occurs, then a targeted biopsy can be done with far fewer cores required. But many doctors have not incorporated MRI yet into the active surveillance protocol. Multiparametric MRI scanning is new technology. As you're no doubt aware, some doctors haven't even heard about it. To get a good quality image, you need good technicians to get the right exposure on the film. You need great equipment, preferably a 3 Tesla magnet. And you need highly trained physicians to read these. One expert told me that these doctors need 1,000 practice sessions before they're really competent to read these MRIs. Lastly, when you have an MRI and they detect a spot, that's not the end of it. You could still need a biopsy. The good news is it might be far fewer cores, but you cannot prove or disprove the presence of prostate cancer with an MRI. You can only be directed to an area of suspicion that would require a targeted biopsy to prove or disprove the presence of cancer. As you can see, multiparametric MRI is groundbreaking technology for men with prostate cancer. We've covered a broad range of subjects today. It is a little bit complicated, but this is such a useful tool. It's very important that you understand all its potential. For more information about MRI and different locations across the United States, go to pcri.org/prostate imaging. Thanks for watching. If you want to learn more about prostate cancer, subscribe to our YouTube channel, visit our website, and sign up for our newsletter.